Hello, everybody, and welcome to SCIP's virtual webinar on next generation scenario planning models for healthcare. Today, we have joining us Oliver Guirdham, CEO of the Business Research Company, and Ravi Kiran, Director of Healthcare and Life Sciences at the Business Research Company. So a very warm welcome to Oliver and Ravi. We're excited to have you here today.
Thank you, Holly.
Just a couple of housekeeping things. This event is being recorded and will be available on our SCIP website for members to access at their convenience. We ask that you keep yourself muted unless specified by our speakers. We will have opportunities for questions and discussion, but until then, we ask that you be respectful of our presenters today and allow them the floor to speak. If you do have questions before the specified time, please feel free to put them in the chat or use the Q&A system at the bottom of your screen. Our speakers today will address your questions around halfway through the presentation. And at that time, you'll also have the option to speak unmuted. So during that time, please remain courteous to each other so that everybody's questions can be answered. My name is Holly O'Donnell. I'll be facilitating this webinar. For all of our newcomers, I would like to introduce a little bit about SCIP, the Strategic Consortium of Intelligence Professionals. We are a nonprofit associated with intelligent thought leadership consisting of individuals and organizations that use data-driven intelligence to become more successful. In thinking about competitive intelligence, this is intelligence seeking to make your business more competitive in the marketplace. SCIP looks to build upon that value proposition to include all things that are data-driven, including healthcare intelligence, economic intelligence, energy intelligence, and more. This idea can be applied to so many different areas, including earth-changing ones like sustainability intelligence, social responsibility intelligence, and more. Helping individuals and organizations to put sanitation systems into developing countries, preserving natural habitats, and increasing our quality of life. Hence the leadership role of SCIP and our terminology of intelligence for the betterment of people and planet. We have expanded our value proposition in order to adapt to the transformative and ever-growing intelligence ecosystem. So as you see here on the screen, we've grown to include numerous aspects to better allow SCIP to align with the way the world operates today from an intelligence technological perspective. Since the intelligence ecosystem has become a focal point and an anchor for SCIP, we have built 9 pillars of SCIP intelligence that function as our value proposition on the global scale. To learn more about SCIP's value proposition and how we utilize our mission to benefit you, please visit our website at scip.org. And now, without further ado, Oliver and Ravi, you have the floor, and we look forward to learning from you.
Thank you very much, Holly. Hello, everybody. My name is Oliver Guirdham. I am the CEO of TBRC, or the Business Research Company. We're a market where we are what we sound like, a business research company, which means we do research into all elements of that would go into a business plan. So it could be competitive intelligence, it could be market intelligence, it could be regulatory insight, it could be about suppliers, etc. So we cover all the different areas that go into your planning for your business, whether it be a go-to-market plan or an expansion plan, etc. We're about 12 years old, and I myself have been working in this industry for other companies like Global Data, Data Monitor, Ipsos Mori for 20 plus years. With me, I have my colleague Ravi. Ravi, would you like to introduce yourself briefly?
Yes, thanks, Oliver. Hello all, this is Ravi. I lead the Healthcare and Life Science Consulting Business Research Company. Started my journey with research in biopharma companies and moved over to consulting, and have over 15 plus years with consulting. We cover 4 main domains: healthcare services, biopharma industry, medical technology, and event.
And so, yes, Ravi and his team, we have a team of about 25 consultants focused on healthcare, which is the core focus of our business. And they are continuously working on projects related that come to us from our clients. So yeah, so a typical project would be an information need that comes from our clients, and then we would go away and conduct that project. So that would involve doing often speaking to a lot of experts, doing a lot of secondary research. We have access to a lot of proprietary databases, etc., and then delivering both information and strategic suggestions based on that information to the client. And that's one of our core capabilities. We also have a huge range of very detailed reports available in the healthcare market. I think over 1,000 different titles within healthcare, down to very niche different markets, which allow you to get visibility on those markets. The subject for today is next generation scenario planning models. So one of the most important things that we're often asked to do, and I'm sure everybody who's working within the intelligence world and who has responsibility for strategy within their companies, is continuously looking at how big is the current market size for this product or service, and how big is the potential. And that is what this lecture is all about, or this discussion is all about, is about some different ways that we go about building models to understand what markets look like, and then how we forecast them forward and understand the scenarios that could play out within those markets in order to forecast what can happen, and therefore from that leads to what will help you to make your decisions as a business and as a marketeer or as a strategist, etc. So this discussion is really about different ways that you can model the future, understand the future, and therefore be able to act upon that going forward. So Ravi, would you like to, the way that it will be structured is we will have about, Ravi will go through the first few slides, about 10-15 slides, introducing the topic. We'll then have a break for anyone who has any questions, and then we'll go on to the second set of slides, and then questions at the end. So anyone who's got questions can either put them in the chat, or they can even speak to us directly if they wish to. Great. Ravi, would you like to run us through the agenda?
Sure. Thanks, Oliver. So as Oliver mentioned, we'll cover about different methods used in forecasting across the healthcare and biopharma industry, and also the tools which are used within each of those major methods. Can we move on to next slide, please?
Holly, are we able to go to the next slide?
Should be able to. 1 second. There we go.
Good. Yeah, this is just a brief introduction to some of the key people in our team. So Ravi, who heads up the healthcare consulting, Arti is one of the key people there. Frank, who's got a very long period of experience supporting biopharma, etc., and then myself as the CEO of the company. I'm not a healthcare or pharma specialist myself, but I'm a specialist in research techniques and market sizing and forecasting methodologies.
Before moving on to the specific models, first we'll try to understand what is the need for forecasting across different industries. One, for healthcare providers to understand patient demand or to utilize their capacity or to understand the patient visits or emergency room visits. For biopharma industries to better manage supply chain, to understand the revenue generation for next year, 5 years, 10 years, or to strategize on their marketing or sales force based on their revenue estimation forecasts that they achieve. And even health systems and governments also do forecast, to better understand any disease outbreaks or uh, for any vaccination programs. The healthcare or biopharma industry employs three major planning models or forecasting models. This is based on the type of the data or the source of the data that we use for forecasting. One, epidemiology-based forecasting model, second, sales-based, and third, prescription-based. Uh, Epidemiology-based planning model, it uses parameters like patient demographics, health outcomes, or disease progression parameters. Whereas sales-based use the historic sales data for forecasting, and prescription-based use the prescription data provided by the electronic health records or healthcare providers. Yes, epidemiology-based planning models is generally used by health systems to understand overall disease progression, or used by biopharma companies when there is not enough drug data or when a drug is not yet in the market, basically to understand the total potential of the target market. Particularly used for chronic or long-term conditions where prevalence rates play a significant role. So this planning model, we use epidemiology parameters like incidence or prevalence of a disease. And this model considers the total population, and from total population, we'll try to derive population affected by disease and the population who are symptomatic and the symptomatic population who are actually diagnosed and treated. Uh, from these steps, we know the total market. And from there on, once we have the diagnosed and treated population, we try to analyze the patients treated with specific therapeutic class, be it oral drugs or other specific class, and then finally the patients treated with the exact target drug. So this is a model where we try to analyze from the total market and narrow down to the exact market for a specific drug product or a specific technology. It is basically used in biopharma industries where there is low or no historical data, or where there is a lot of disease progression data, which is not easily uh, used to forecast using sales-based or other models. Sales-based planning model uses historical sales data from the suppliers, including wholesalers, retailers, and other intermediaries supply chain. It is used when the market is already launched in the market, when the drug is already launched in the market, and we have historic sales data, basically used by biopharma companies for planning, budgeting, decision making for monthly or quarterly or annual forecast based on the historic sales data. So prescription-based planning model, it uses the prescription information, prescription written by the providers, basically utilizes the data from electronic health records, pharmacy dispensing systems, or prescription databases. So basically, prescription model gives information on patient demographics and prescription trends. This approach also helps to understand how regulatory changes affects prescribing practices. And this model is used to anticipate demand for drugs at prescriber level, enabling pharma companies to tailor their marketing and sales strategies. So now that we covered the different major broad methods based on the data source that we use for forecasting, we will now deep dive into tools which are being used to do exact forecasting. Basically, the tools are divided into qualitative and quantitative tools. Quantitative tools, here we present the tools, statistical tools, AI or artificial intelligence or machine learning based methods and hybrid methods. And qualitative methods include expert interviews. So we'll touch upon each of these major type of the tools, how they are used, why they are used, and choice of forecasting or choice of choosing a tool depends upon specific forecasting task, characteristics of the data, and level of uncertainty that needs to be addressed. Basically, it also depends upon the life cycle of a product. For example, if we take biopharma, if a product is still in preclinical, then we will choose qualitative methods or the methods which do not use any historical sales data. But if a drug is already launched into the market, then we have a good historic time series data where we will use statistical methods, which we will cover in the next slides. Yes, here we briefly described major statistical methods. One is ARIMA, auto-regressive integrated moving average method. Second, Holes or Holes-Winter method. Third, BAS method. And fourth, different epidemiology-based method. Of course, there will be few other statistical tools as well, but here we cover the most popular and most used statistical methods, uh, uh, which are published, and there many use cases have been published using these statistical methods. So these statistical methods are generally called time series forecasting techniques, where they use historical data. As I said, ARIMA is the robust and most used model. Many publications and use cases for ARIMA across biopharma and healthcare industry. Basically, this ARIMA forecasting model has three components. Uh, Name itself implies one is auto-regression, second integration, and third moving average. So using these three components, uh, the parameters, three component parameters can be identified and the data can be fit into the model. The main limitation or the main uh, requisite for ARIMA is that the data should be stationary. Stationary, we can define it as the statistical properties such as mean, variance should be constant or uniform. Even if the data is not stationary, we can do it differentiation to make it a stationary data and then use it for array. Uh, there is a updated model of ARIMA, which is called SARIMA, which also includes seasonal data, where normal ARIMA we couldn't able to use for data with seasonality. Seasonality means repetitive cycles, monthly, weekly, or other repetitive type of data, which is more frequent in healthcare, based on healthcare as there are frequent flu or other outbreaks. So ARIMA is for stationary data, whereas SARIMA is for stationary, as well as data with seasonality. So there are many use cases of ARIMA which are published. Here we uh, show few use cases which across the healthcare and biopharma industry. One, this model can be used for resource utilization tracking, analyzing equipment usage, or even patient length of stay, to understand disease outbreaks, to understand demand for any capacity planning, and specifically biopharma companies to understand the revenue forecast or the drug sales in the long term, and for strategic planning or for the new drugs or policy changes. So there are several use cases of ARIMA across biopharma and healthcare industry. So here we present a case study where we put a case study which is published and in the public domain. Here, in a healthcare department, government in the city of Indonesia has used ARIMA model to forecast dengue patient numbers, and the method used stationary data and the method aided in healthcare planning, hospital budgeting, staffing, and medicine stock management. So this is the second most popular model, which is called Holes model or Holes-Winter model. As in ARIMA, there are three components: auto-regression and moving average and integration. Here we have two parameters or two components. One is level and second is trend, which we term it as alpha beta. And there is an extension of Holes model, which is used for seasonal data, where we calculate gamma as well. So basically, two parameters, and this is also most used statistical time series data tool. Uh, and if the data has seasonality, then we have to use Holes. So the difference between the two models, ARIMA and Holes, is ARIMA can be used for more complex data, where there is more non-linear data. And it can be used for both long-term, short-term, whereas Holes model is generally used for short-term predictions. Yes, so an use case of Holes model, a health department in Brazil used this model to forecast the number of COVID cases during COVID. And this model was efficiently used to understand the disease prevalence and to strategize on different vaccination programs and healthcare system management. Basically, this Holes model is a smoothing exponential model. in difference to ARIMA model. So where Olds model and ARIMA model, we try to forecast based on the historic sales data, and we have sales data and the drugs which are already in the market or any information that is already, we have historic data. In contrast, this BOSS model can be specifically designed to capture the diffusion of new products or innovations in health in the market. And these model parameters include external factors that influence adoption process. So basically, there are two parameters. One is innovators and imitators. So we calculate those parameter coefficients and use those to predict any new sales of a drug or adoption of any new healthcare technology. So in a way, the BOSS model is a statistical tool, but it differs from ARIMA tools in that it can be used to understand the adoption of a new technology or prediction of a new drug which do not have any historic data. So in a case study, an Australian biopharma company has used this BOSS model to forecast the adoption and market penetration of a newly launched drug. So they gathered data for around 100 plus drugs in Australia for about 10 years, and then they use this model, and the findings include findings shows that it takes around 8 years for a new prescription drug to gain wide adoption in the country, and the external factors such as regulatory forces impact around 20 plus drugs, whereas the internal factors or other market demand factors impact around 80 plus drugs. So this is a good case study which helps understand the penetration of a new drug and the forces or factors that impact the adoption of a new drug. So now there are, yes, SIR, SIRD, SCIR, SIQR, these are all the models which are epidemiology-based models. S stands for susceptible, I stands for infected, or D for diseased or for recovered, Q for quarantine, V for vaccination. So these are all, in all these models actually, these are compartmental models commonly used in epidemiology to understand spread of infections or diseases in the population. These dynamics of these models are governed by ordinary differential equations that describe the flow of individuals between different compartments. Basically, the applications of all these four models are in epidemiology studies to understand peak infection rates or duration of an epidemic. These models are also used for policy planning to assess potential impact of interventions such as vaccinations or quarantine protocols, and even to understand the parameters such as disease transmission rate, recovery rate, or mortality rate.
Good. I think let's take a pause there, Ravi, because we've covered quite a lot already.
Yes, this completes statistical model section. And before moving on to other types of the methods, we can hold on and check for
great. So I wonder if has anybody in the audience, would anyone in the audience share their experience? Whether anyone has used any of these models in their work, and what sort of benefits and issues they might have seen with the different models they've adopted. And yeah, that's a suggestion. But if anyone's got any other questions that they would like to ask at this time, just feel free to let us know.
Hi, I don't have a experience of using the models, but do have a question. When it comes to forecasting, that obviously comes with some inherent uncertainties. So I'd be interested to hear what your thoughts are around the factors that affect the accuracy of forecasting.
Yes, so I mean, I think I can start on that on a more general level. So yeah, clearly the some key factors are how much of a history of data do you have for that market, right? So how established is the trend that you're able to see in the historic data relating to a specific market. So if you've got good quality hard data for a long time series, that is clearly very useful. Then there's the question of kind of what parts of that data can be separated out. So are you able to, for instance, split out inflation or split out GDP growth from the historic data, so that then you can, if you have forecasts of what's happening to those specific factors going forward, you can separate them out and look at the baseline growth of the market, which is specific to that market, and then add in your forecasts for other factors such as inflation or general economic growth, GDP growth, etc. So those are some important factors in terms of how accurately you can forecast. Other things that affect it are how much visibility do you have on changes that are happening as you go forward. So if you're for example expecting if there's a known regulatory change coming in 2 or 3 years in your market, then you can build that into your model and have an estimate of what impact that will have. But if on the other hand the regulation hasn't yet been passed, but it's likely that some regulatory change is going to happen, that is harder to forecast on and harder to interpret. Technological change can be harder to forecast on. I think at the moment, everybody's wondering what the impact of AI will be on hundreds of different markets, be they healthcare or elsewhere. And I think anyone, it's a brave call on what some of these markets will look like after as the impact of AI grows. So those kind of unknowns make it more difficult to forecast forward a market. That would be the kind of general answer. Perhaps Ravi, you can talk a bit more specifically from the healthcare perspective.
Yes, so once we decide on the forecasting method or model based on the end purpose of forecasting, then the basic steps to see that the model is a good fit is how we are pre-processing the data, removing any data outliers, and what checks are we doing on the data to understand if the data is linear, non-linear, stationary or non-stationary. And then what are the techniques that are using, or how you are assessing the accuracy of the forecasting model, such as how are we understanding what are the mean absolute errors or other root mean square errors once we validate and fit that model on the actual data. So also we can actually divide the data that we have into training and test it, and then perform the testing on the actual information that we have, and see how much absolute variance we have with the predicted information to actual data. So all these checks we can update our model and see there are minimal errors for predicting the future values.
Good. Thank you for that, Ray. And does anyone else have any questions at this point? Anything that anyone hasn't understood or would like to contribute?
Yeah, hello.
Hello. Hi, Ravi.
Yeah,
Is this
yeah.
Ravi or who's speaking?
Yes, Ravi. I would like to ask which forecast model we need to use priorly. How we will decide which forecast model we have to use. I mean, based on which parameters we will decide.
Yeah. So
based
I
on
mean,
that,
it's definitely not a one size fits all thing, Ravi. So we'll make a decision based on what we're trying to do, right? So yeah, so if you're and also what information you have available to you, right?
Yes.
If you've got detailed statistical information then a whole range of forecasting models are available, which are not available if you've got, like, let's say, a completely new product in a new market, or the data is very weak, or you're working in an emerging market where or you're dealing with, let's say, you know, unofficial markets where maybe the sales data isn't recorded. All of those things are factors. So it's not a matter of like what's the best forecasting model. It's a matter of finding the most suitable forecasting model for what you're trying to, according to two things: what you're trying to achieve, and what information you have available to you. Ravi, would you like to add to that?
Yes, I agree with you, Oliver. So depends on characteristics of the data and then purpose of the forecasting task. And also depends, as I mentioned earlier as well, depends upon the life cycle of the product, whether it is in preclinical stages or whether it is already launched in the market, or even when the drug loses market exclusivity, where there is a lot of competition, then we have to use different models for forecasting, because there is competition from the other competitors and generic drugs as well. So based on the characteristics of the data, how clear the data is, and based on the life cycle of the product as well.
Wonderful. Any other questions at the moment? Great. Well, if you haven't got any questions now, then we'll carry on, but feel free to store up any questions for the end, or to drop a note into the text box, and we'll pick up on that.
Yes. So until now, we covered the tools, the statistical based tools, which are most used on time series data, and where the data is mostly stationary. If not stationary, then there are definitely add-on features used by statistical methods to make the data stationary. And the data is simple or linear. But in healthcare, always the data is not stationary, not linear, complex, like patient health records, information from electronic health records, or other healthcare images. So once we have more enormous data and complex data, then statistical methods may not yield correct forecasting numbers, and there comes advantage of artificial intelligence or machine learning based methods. So there are several methods, but we just will bring on two major used methods for an overview of the AI based methods. Can we move on to next slide?
Sure. So we're now talking about forecasts which are kind of generated essentially through AI or through machine learning. So they're pulling in data from a much wider range of sources, or a much less controlled set of sources potentially. Is that correct, Ravi?
Yes.
Yeah.
So these AI/ML based methods are non-linear methods adapted to address the limitations of linear statistical time series methods. And mostly these models are self-adaptive, require minimal assumptions about relationships between variables, whereas in general statistical methods, there should be a linear correlation between different variables, which is not needed for artificial intelligence-based methods. And these methods provide better predictions for complex relationships. Only that we should have more more expertise to use these artificial intelligence-based methods. So there are different types of AI-based methods. One broad category is artificial neural networks. These, again, we can divide into two types. One is shallow networking methods, and one other deep networking methods. Shallow networking methods, these are used for comparatively simpler tasks, such as patient admission rate, or emergency room admissions, or drug forecasting with historical data. Whereas deep neural networks we can use for complex healthcare tasks, such as analysis of CT scans, MRIs, or even the patient data having multiple disease progressions or genomic data. So both shallow and deep neural network, they will differ in terms of the number of layers in the actual model, the number of layers between the input and output layer. And also all these artificial intelligence based methods depends on we have to divide the data that we have into test set and training set, much of training set, and then we have to train the data and fit the model to use it for predicting the test set. So support vector machine is the type of machine learning method, a shallow machine learning method. Basically, this is most effective for binary classification, such as a patient has a disease or do not have a disease, or predicting the prognosis of any disease. Basically, for binary classification, this is most used machine learning.
So Ravi, one question here. I mean, what did we do before machine learning and AI? I mean, we must have needed to make these kind of calls about from sets of data which were not complete. So is the alternative to do this kind of for essentially qualitative forecasting and qualitative scenario planning by humans, and then it can also be done, and now it is being done increasingly by AI and potentially being done better by AI? Or what do you see my question?
Yes, Oliver. So definitely qualitative methods are always there. Even now, qualitative methods are an alternative when we do not have a correct judgment from using these AI or machine learning methods. So these are black box methods where we do not know how exactly the data is being forecasted. Even statistical methods, we have a bit of transparency to understand what is the correlation between different variables. But in machine learning methods, using the training data set, the method you will form relations, or it is a type of black box method. So definitely there are judgments, the qualitative interviews, Delphi methods, all are being used when we do not have machine learning. Even the time series statistical methods are there. Auto regression, moving averages, even Bayes and hierarchical methods are available. But these are increasingly being used because we have more amount of complex data and more enormous data.
So where people might have done a qualitative study or something built on some kind of regression of what data was available, they're increasingly using these kind of models because the amount of data that they're capable of ingesting is much higher.
Yes, there are many use cases where people have used multiple techniques or tools on the same data, and once they're satisfied that machine learning or ML-based method shows more accuracy and more prone to use these methods. So now that we covered artificial intelligence or machine learning methods, the new methods are hybrid methods, which uses either two machine learning methods or one of statistical plus machine learning methods to cover the limitations associated with each of the tool or method. Here we cover two major hybrid methods. One is ARIMA-ANN, where ARIMA is a statistical method and ANN is an AI-based method. Yes. So as mentioned, hybrid forecasting methods use multiple forecasting methods to enhance effectiveness and provide high accuracy by combining the strengths of both methods, both linear and non-linear models. Linear here implies to statistical and non-linear machine learning. Hybrid methods can include both statistical methods, both machine learning, or a statistical machine learning as well. So ARIMA-ANN is one of the most popular hybrid methods, which is used where the data has both linear and non-linear characteristics. And most successful hybrid methods where there are many use cases across healthcare and biopharma industry. Yeah, specifically used for sales predictions of the complex or pharmaceutical drugs, which are used for multiple indications or multiple disease progressions. Patient services, emergency department visits, and forecasting, like even epidemiology infectious disease spreads. So here we put a case study of where an university has tried to use all the three models, ARIMA, ANN, and also hybrid model, including ARIMA. And they used 80:20 ratio of training and test sets with the available data, and tried to forecast the prevalence of the tuberculosis. And they found out that the hybrid model has more accuracy compared to using the individual models. So this is another hybrid model where two statistical tools were used. One is ARIMA, second is Coles-Winter method. And whereas ARIMA is more complex, Coles-Winter is a bit simpler, but Coles-Winter is better for seasonality and data having time. So both models, both tools were used as a hybrid model. Yes, this is one more use case where it is published that a pharmaceutical company has used this arrow model, ARIMA Coles model, to forecast the demand for 34 drugs across 6 therapeutic areas. And they found that the arrow hybrid model is better when compared to individual ARIMA, even Coles-Winter model. Yes, so until now we covered all quantitative techniques, either they are statistical, artificial intelligence, or even hybrid models. But where we do not have any information, any historic information, or where we do not have, where we cannot take decisions based on the quantitative method, definitely qualitative methods are useful. One is to understand the qualitative method, these are subject to assessments, expert judgments, and expert interviews. Uses Delphi method and other surveys. Useful when historic data is scarce or when companies wanted to adopt new sales approaches. Clarifies ambiguity from quantitative forecasting. Advantages of these are swift and straightforward, not requiring extensive data collection. These are simple to conduct, not very complex as those models when the data is very low. However, there are limitations definitely, relying on the opinion of the expert and not using the exact sales exact quantitative. So here we wanted to present a case study where we did in the business research company for a pharmaceutical client, where a client wanted to analyze demand for his product portfolio of more than 50 drugs. So how we did is we have first segmented the drugs based on drug category or growth opportunity or revenue share. The purpose of the segmentation is that the related drugs have similar demand patterns. So once we have classified the category, either the drugs intubated, the generic, or the drugs having a same therapeutic area such as oncology or other metabolic diseases. And we try to assess the growth opportunity of a drug, whether the drug has patent exclusivity or there is a generic competition for the drug. And revenue share, whether the drug has a major revenue share or notable share. And once we assess these parameters, then we have assigned a statistical or assigned a forecasting model based on all these classification levels. So suppose a drug is into oncology or hematology and having major revenue share for the company, and there is minimal variation of demand from past 3 to 5 years, then statistical methods or we can use statistical methods as high priority to forecast the future price. If a drug is having major share of revenue but high variation, there is a lot of variation in the historical sales data, then we suggest artificial intelligence methods or hybrid methods. And if a drug has notable share and high variation, again, artificial intelligence or hybrid methods. If the drugs or the class of drugs have low revenue share and minor variation, then we can simply implement qualitative or statistical methods. And for generics or even first-in-class market where there is no information, then we can do expert interviews to understand the forecast trends. So in summary of these presentation, forecasting models are used across healthcare providers, health systems, or even biopharma industries to understand the demand for business decisions or for marketing sales strategies. A model is adapted based on the type of the available data and the objective and complexity of the data. And the three major models based on the data source are epidemiology, sales-based, or prescription. Based on the tools, there are many tools, statistical, AI-based, or hybrid, or even qualitative. And next generation planning models are such as AI, ML, or hybrid methods are increasingly being used across the biopharma or healthcare industry currently.
Great.
So
Well,
that
thank you
is
very much, Ravi. That's it in terms of the presentation. We hope that you found that useful. I'm not sure. I don't think we've got any questions in the chat at the moment. Is there anyone who'd like to ask a question?
Hi, it's Ray again. On the subject of forecasting, what's your thoughts on carrying that out in-house or using an agency for carrying that work out?
Yeah, so I'll start on this one. I mean, obviously, everyone needs to take into account the fact we are an agency, so I may be biased. I think the advantages of agencies are, I think, some objectivity, some distance from you as a company or as an organization and your products and services. People can be quite emotional about it. Particularly like if you're basing your forecast on input from your sales teams or your customer reps, etc. While they can be very useful source of information, you have to be making sure that you're seeing the kind of inside and outside view of your product and the broader spectrum. It can be easier for agencies to speak to particular people, like it might be doctors or physicians or those kind of things, because they've got the setup to do it, and B, the physicians will see them as objective or not tied to a particular product or service. So it's easier for them to speak to them to somebody from an agency. And yeah, obviously we do, agencies like us do this kind of work all the time, so we develop a strong expertise in it. And then finally, I guess from the external point of view, people may trust it more if it's from an agency with a good reputation that's clearly following a strong methodology, etc. In terms of the advantage of doing it in-house, I think there's the consistency. So if you go to an agency, particularly one that's not well established, there's the possibility that it might not be there in the future, or their quality might drop, or that kind of thing. So you've got more control internally, and there's advantages in terms of cost generally as well. It tends to be a bit cheaper to do it internally. But yeah, so there are a range of different aspects to it, but I think most companies like to use some external information, some external market sizing, forecasting, market interpretation information to double check their own findings, because otherwise they can become a little inward looking and perhaps miss some tricks in terms of what's really going on. Ravi, anything you would add to that?
Covered most of it. Basically, expertise and the capability available with the agencies that will help better forecasting than doing it where there is a bias on this.
Yeah, of course, in-house teams can also become very, great, have great expertise, but it tends to take time to build it up. So particularly if you can't afford to build such a big team over time, or if you're building up that team and you want support in the shorter term, then agencies can be very useful as well.
Thank you.
Any other question? Thanks, Ray. Anyone else got any questions or any thoughts? Anyone who's used any of these methodologies and wanted to comment? No, it doesn't look like it. I can see one or two people are heading off now, so I guess they've hopefully got something out of the session. So I think that's it from our side, Holly.
Sure. We did have a couple questions about PowerPoints. We at SCIP will be sending out a survey to all attendees asking for feedback, at which point we will be able to send out PowerPoints. Of course, that is related to how comfortable Oliver and Ravi would be with sharing that with all of you today.
I think it's fine. Yeah, we're happy to share this.
Sure. Okay, so then anybody that wants to get access to a PowerPoint, please make sure to fill out the survey that will be in a follow-up email. If there are no other questions at this time, I want to say a very deep thank you to everybody for attending. A very much thank Oliver and Ravi for presenting today. That was some fantastic information. I hope everybody learned a lot. And we will continue looking into this with Oliver and Ravi.